Tangulbei is located in Baringo County in the Great Rift Valley. My name is Father Maxwell Atuguba. I belong to the Congregation of the Holy Spirit. In Tangulbei here at Catholic Mission Health Center, we offer services like skill delivery, treatment of malaria, cholera, and other diseases. We also offer immunization services, laboratory services, referral services, that is the ambulance services that we have. The ambulance is not a standard ambulance. It is difficult, for example, when you are referring a mother who is in labor, covering a distance of 120 kilometers on a rough road. Sometimes you either lose the mother or the baby or both at the same time. We have to refer patients from the medical facility here to Cabernet Referral Hospital because we lack the requisite medical personnel to perform some simple procedures like cesarean section, which most of the mothers who come here to deliver have complications. And because of a lack of a medical officer, we are forced to take them to Cabernet for medical attention. NLW has assisted us to establish a maternity unit, which has greatly increased the number of safe deliveries at the hospital, and they have also been able to help us to establish a waiting house. This became very necessary because we realized that mothers who try to deliver at home in the hands of traditional birth attendants are not able to make it successfully. And by the time we go for rescue, it was always too late. The waiting house is a place where women who are in labor or who are expecting to be in labor within a short time come to stay there because most of them come from very far distances, covering over 35 kilometers, 20 kilometers and thereabout. So with the establishment of the mother's waiting house, they can come a day before or maybe 2 days before, and they are under observation, and then they have safe delivery at the facility here. The government has given this facility a target of 200 deliveries. We are in November, the middle of November, and we have already hit our target. By the end of the year, December, we would have gone beyond the target that government gave us. This demonstrates how helpful the establishment of the maternity wing is to this facility and to the community. Concerning the lack of qualified staff at the facility, there's light in the tunnel because of our able collaborators like NLW that has recently sent in a student nurse who is on internship to have an experience at the facility. Actually, she's been very helpful to the nurses. She's able to carry out immunization. She's able to take basic medical observations, which we would have needed to bring in somebody else to do, but she's filling in a gap. And we are praying and hoping that when she's done with her studies, she will come back to support us. That is our big appeal and hope. What we actually even need here most is the medical officer, a clinician, another laboratory technician, and then somebody to operate X-ray and this full mammogram. We also lack the needed equipment like full mammogram, like an incubator, like even blood bank. We do not have such. If we had more qualified staff and better equipment, we'll be able to save lives. We are not able to have more staff, enough equipment here because of resources, lack of resources. Though patients make effort to pay, most of them are not able to pay because of their economic circumstances. Another challenge we have at the facility here is lack of accommodation, because most of them come outside this community and they are not able to find comfortable accommodation. But thanks be to God and thanks to NLW, our reliable partner, they are currently sponsoring us to put up a 2-unit staff quarters, which hopefully will be able to accommodate our staff comfortably so that they can operate easily in this facility. Our immediate future plans will be to establish a theater where we can have the simple procedures done here. We also need a pediatric ward because this is highly populated and most of the cases that we receive are children. However, in the future, with the willingness of the community, with education of more people, this facility will become self-sustaining and will be able to offer the services that the community needs.